Hey everyone, welcome back to The Explainer. Today, we're popping the hood on one of the most complex, yet honestly incredibly fascinating systems in the modern world, the managed care industry. Whether you're an industry professional, an investor, or just someone who really wants to understand how health insurance actually works behind the scenes, well, you're definitely in the right place. We are going to completely demystify the massive economic engine that powers managed care, and we'll look at the hidden sustainability risks that threaten to literally derail the whole thing. All right, let's dive right in.
So here's our roadmap for today. We're covering 1. The managed care economic engine, 2. The data security threat, 3. Balancing costs and access, 4. Tracking plan performance, 5. Improving patient health outcomes, and finally, 6. Climate change risk models. Starting with Section 1, the managed care economic engine. To truly get managed care, we've got to understand its fundamental business model first. Now, the absolute core economic dynamic of this entire sector relies on a constant, almost precarious balancing act between two massive macroeconomic pillars. Picture it like a giant scale. On one side, you have enrollment. An organization's enrollee count, individual, commercial, Medicare, Medicaid members, traditionally rises and falls directly with employment rates. Basically, when employment is high, enrollment in employer-sponsored plans is high. It's that simple. But on the other side of the scale, we have revenue. And revenue is primarily driven by the relentless pace of medical cost inflation. As the cost of care goes up, revenues generally tend to go up. But there's a major catch here. Legislative uncertainty, plus a massive societal push to reduce healthcare costs, puts serious downward pricing pressure on these companies. So the big takeaway here, managed care companies are caught in this perpetual tug of war. They have to constantly manage their employment-driven enrollment numbers while simultaneously trying to outpace that relentless medical cost inflation. It's a tough spot to be in.
So you might be wondering, how do companies and investors actually keep track of the health of this massive economic engine? Well, they rely on standardized metrics. The SASB standards actually provide the essential toolkit that these organizations use to track and hopefully mitigate the specific sustainability risks that threaten this super delicate balance. And throughout this explainer, we're going to lean on the SASB framework for the managed care sector to show you exactly which metrics actually matter the most. Let's move on to Section 2, the data security threat. We're pivoting to our first major operational risk now. You might think cybersecurity is just an IT issue, right? Just a bunch of servers and firewalls. But in managed care, it is fundamentally an enterprise valuation issue. I mean, when your absolute lifeblood is enrollment, losing your customers' trust is just devastating. To really grasp the risk, we have to look at what's actually at stake here. The standards specifically isolate personal health data. That's personal data related to someone's physical or mental health that reveals their health status. And here is a slightly terrifying yet fascinating fact for you. A single compromised healthcare record often sells for significantly more on the dark web than a credit card number. Because managed care companies hold these vast, massive repositories of deeply private information, they are prime targets for cyber attacks. Failing to secure this data? Yeah, that doesn't just mean bad PR. It means getting hit with massive civil and criminal penalties. And because the stakes are literally that high, companies cannot just wave their hands and vaguely promise that your data is safe. They absolutely must disclose exact, highly granular security metrics. We're talking the total number of data breaches, the exact percentage involving personal data, the percentage involving health data specifically, and the total number of affected customers. This is transparency in action. It gives investors and consumers a clear, quantified look at exactly how well a company is protecting its most sensitive asset. And this brings us to why those metrics matter to the bottom line. The framework requires companies to disclose the total amount of monetary losses resulting from legal proceedings over data security and privacy. So we're talking everything from civil judgments and settlements to heavy regulatory fines and criminal penalties. A data breach is not just some abstract tech glitch. It is a direct, measurable drain on the entire economic engine. Okay, Section 3, balancing costs and access. Let's see how this all feeds into the broader strategy. We really need to look at how the industry navigates the constant pressure of medical cost inflation against the absolute non-negotiable need to provide accessible coverage. And that brings us to the medical loss ratio, or MLR. This formula is easily one of the most crucial concepts in all of managed care. It tracks the percentage of total healthcare insurance premiums that a company spends directly on medical claims, and importantly, efforts to improve the quality of care.
It's essentially forcing transparency. It shows exactly how much of your premium is actually going toward healthcare and patient safety versus how much is just getting swallowed up by administrative costs or corporate profit. So improving access isn't just about throwing plans out into the market. It's about making sure those plans are actually delivering real value to the patient while staying compliant with some pretty strict cost control regulations.
Moving right along to Section 4, tracking plan performance. Remember that core economic dynamic we talked about earlier? Enrollment is everything. In such a cutthroat, highly competitive market, how did these companies actually keep those crucial enrollee numbers from tanking? Well, they track customer satisfaction with surgical precision using 3 critical performance metrics. First up is the enrollee retention rate. Simply put, how many people are actually choosing to stick with their plan? Second, the percentage of reversed denied claims. This one is huge. It tracks how often a company denies a claim, the customer fights it and successfully appeals, and the company has to admit, oops, our bad, that denial was invalid. High numbers here? That is a massive red flag for a frustrating customer experience. And third, the plan enrollee grievance rate, which measures formal complaints about timeliness, access, or quality of care. If a company drops the ball on these metrics, people will absolutely leave, which directly attacks their market share. Let's look at Section 5, improving patient health outcomes. So if medical cost inflation is the great looming threat to revenue, how does a managed care company actually fight back? Well, they invest in long-term patient outcomes. It's a strategic, preventative measure. And that leads us straight to wellness programs. The standard actually tracks the percentage of enrollees participating in programs for diet and nutrition, exercise, stress management, mental health, smoking or alcohol cessation, all of that. Now, why does this matter so much? Because of primary and secondary prevention. Primary prevention keeps healthy people healthy, and secondary prevention catches diseases early before they become a massive problem. If a managed care company can get its population engaged in these programs, they fundamentally alter their own future liabilities. Healthier enrollees literally mean fewer hospital visits, which is the absolute best way to directly control that medical cost inflation we keep talking about. And finally, Section 6, climate change risk models. We have to look to the horizon here. We're looking at a massive systemic risk that threatens to upend the foundational risk models of the entire healthcare industry. The impacts of climate change on human health. Think of this like a massive domino effect. The standard actually requires companies to discuss their strategic approach to this exact sequence. Domino 1, an increase in extreme weather and natural disasters. Domino 2, this causes changes in the geographic incidence and morbidity of illnesses. Imagine tropical diseases like malaria or dengue fever moving into regions that have never seen them before, or way higher asthma rates because of heat-induced illness. Domino 3. This inevitably leads to a massive spike in health system encounters. Basically, more sick people need more care. And the final domino, managed care companies absolutely must incorporate these new realities into their financial risk and risk adjustment models. If they fail to predict these geographic and environmental shifts, their entire pricing structure just completely collapses. Which leaves us with this final thought. We've seen today how the managed care economic engine relies on this incredibly delicate balance: enrollment tied to employment and revenue constantly chased by medical inflation. Now, take all of that and layer on the unpredictable shocks of accelerated climate change and rapidly shifting global workforces. How on earth will this industry adapt its risk models to survive the coming decade? It is a colossal challenge, but by tracking the right metrics, from data security down to patient outcomes, we can actually see exactly how the smartest companies are preparing for the future. Thank you so much for joining me for this explainer. Keep asking those big questions, and I'll see you next time.